Dear students, the class for today is Pulmonary Tuberculosis, and it is in the form of a chart. Whenever we use the word pulmonary tuberculosis, we mean primary tuberculosis, secondary tuberculosis, and miliary tuberculosis. All the three should be borne in mind. Now we shall go to them one by one. This is the Gonz Complex. I am able to see the trachea, the bifurcation of the right and the left bronchi and the lung. Now what happens is, whenever there is an inhalation of an infective particle, it gets impinged in the subpleural region because it cannot go beyond that, which is called the Gonz focus. And together with the hilar lymph nodes and the draining lymphatics, it is called the Gonz complex. This is the histological hallmark of the tuberculous lesion. I am able to see the large epithelioid cells, central area of necrosis. The nuclei have joined together to form a multinucleated giant cell, and there is a peripheral cuffing with smaller, darker lymphocytes and fibroblasts. So please do remember this granulome. This is the gross picture of the same. I am able to see a resected specimen of the entire lung. And this is the subpleural focus because it cannot go beyond that. So this is called the primary focus or the Gonz focus. Along with the draining lymphatics, it is getting the hilar lymph node involved. So there are three components: the subpleural focus, draining lymphatics, and the hilar lymph nodes. All together, they constitute the Gonz complex or the primary complex of the lung. So this is a higher magnification of the same. I'm able to see the Gonz focus and the hilar lymph nodes, invisible lymphatics. Sometimes I find that when it is persistent, it can undergo calcification also. So an yellowish white necrotic area is becoming calcified to form a radio-opaque substance which can be seen later. Having seen the primary tuberculosis, we should know what is secondary tuberculosis. This is a good picture of it, the sequence of events in a secondary tuberculosis. The secondary tuberculosis, it usually affects the apex of the lung because of the increased oxygen tension. So there is a focus there and it undergoes a necrosis. After that, there can be an involvement of the surrounding tissue. Also, it can erode into a bronchial tree, as a result of which all the contents are emptied, leading to a cavity. So, I am able to get multiple cavitatory lesions in the upper lobe in the apex of the lung. Also, on involvement of the bronchial tree, the disease is able to spread to all parts of the lung as patchy areas of consolidation, classically called as bronchopneumonia. And there will be a sudden deterioration in the condition of the patient, which is called galloping consumption. So, a primary focus, formation of a cavity, and then the spread of the disease. There is a bronchopneumonia, together leading to a galloping consumption. This is an actual picture of the same. I am able to see a cavity, multiple patchy areas of consolidation involving the entire lung. And this is seen more clearly in the apical lobe in this specimen. So there are patchy areas of consolidation, the pale areas. This is supposed to be relatively normal. The lower lobe is relatively normal, whereas the apical lobe is completely replaced by a tuberculous bronchopneumonia. Radiologically also, I will be able to see multiple patchy areas of consolidation, which is classical of a bronchopneumonia. This is a larger version of a cavity surrounded by patchy areas of consolidation, and this is a tuberculous bronchopneumonia. So we have seen the primary tuberculosis and the secondary tuberculosis. Primary tuberculosis, I repeat, there will be a focus, the Gonz focus, the hilar lymph node, and the draining lymphatics. Whereas the secondary tuberculosis, it involves the apex, formation of cavities, and patchy areas of tuberculous bronchopneumonia. The third one is the miliary tuberculosis. The word miliary means millet seed-like, and they resemble canary bird feeds. They are supposed to be 1 to 2 millimeters in diameter, hardly visible to the naked eye. Here I am able to see multiple spots, and the intervening lung parenchyma is almost normal. So this is a classical picture of a biliary tuberculosis. There are different types of biliary tuberculosis. We must read them up. A pulmonary miliary, systemic miliary, etc. All said and done, this is the histological hallmark of tuberculosis. It can be a tuberculosis of the lung, tuberculosis of the intestine, a tuberculous meningitis, or a tuberculous osteomyelitis. You will be getting a granuloma. A granuloma is nothing but a localized aggregation of modified macrophages called the epithelioid cells. In this picture, I am able to see large pale cells. This is the nucleus. And surrounding the nucleus, I am able to see the pale cytoplasm. So there is an aggregate of these cells. And this is one large cell where multiple nuclei have joined, and they are dispersed in a necklace-like or a horseshoe-like pattern. This is called the Langerhans. Don't say Langerhans. It is Langerhans giant cell, which has got a horseshoe-shaped appearance or a necklace-like pattern of distribution of the nuclei. Surrounding both of these, the giant cell and the epithelioid cell, I am finding multiple smaller, darker cells, namely the lymphocytes. So these are the three components of the granuloma: epithelioid cells, multinucleated Langerhans giant cell, and then the lymphocytes, which are walled off by means of fibroblasts. So this is a beautiful diagram which people can draw. Again, I am able to see a multinucleated giant cell, the pale epithelioid cells, a central area of necrosis. The lymphocytes are here, and these in turn will be surrounded by basket woven fibroblasts. So all these are clear for you people. Now what will happen is, these can come as questions for us. Any of this, the primary tuberculosis, the secondary tuberculosis, or the miliary tuberculosis. Coming back to the chart, it displays the entire thing. I hope you people will be able to distinguish the sequence of events and the difference between the primary tuberculosis and secondary tuberculosis. A case history can be given and it can come as an essay question. So the importance is, it can come as a chart, a specimen, a slide, a short note, or it will be definitely forming part of the Viva OC. Kindly be thorough with it. Kindly go back to R.A.T.S and game.